You're listening to the Move to Value podcast, powered by Chess Health Solutions. The Move to Value podcast is dedicated to helping healthcare providers understand and make the transition into value-based care. We do this through conversations and the sharing of innovative ideas with practitioners, experts, and leaders throughout the healthcare industry. Our mission is to sustainably transform the healthcare experience for the patient, provider, and care team by cultivating a value-oriented, compassionate, and health-aligned community. In this episode, we hear the second half of a conversation between Chess Vice President of Value-Based Operations, Josh Vire, and Wilson Gabbard, Advocate Health Vice President of Quality and Condition Management, who discuss the importance of partnerships with payers and implementing value-based care practices with all patients, even if they aren't in a value-based agreement.
Wilson, thank you so much for being willing to stick around and continue this conversation. I really appreciate it. Wilson, you had just talked about on our last episode, you talked about clinician engagement, that relationship management, and that activation. And this is something that I think you guys have been leaders in for a while in the Midwest. Your team not only supports the medical group of Advocate, but also support a large CIN that includes a significant number of aligned independent physicians in the area. Can you talk a little bit about the challenges of supporting aligned physicians versus the Advocate medical group?
Well, absolutely. And thanks again, Josh, for inviting me to participate in this forum. So I think, we certainly don't have all of this figured out. I'd be lying if I said we did, but I think many of our listeners will probably appreciate the challenge that it is to operate in both of these worlds. And in our space, especially here in Illinois, it's especially pronounced. I think we have over 830 aligned clinics that participate in our clinically integrated network. And so the challenge that we talked a little bit about last time about the data exchange and data exchange barriers is incredible, especially at that scale. But I think true clinical integration is really hard to accomplish without strong data and handoffs. And so I think we've leaned into this space of trying to bridge that gap with data exchange efforts, again, tying back to some of the work we're doing in ECQM reporting, to kind of bridge the gap between those aligned EMRs and our data warehouses so that our reporting is as accurate and as timely as possible, that we aren't reaching out to patients for Medicare wellness visits, annual wellness visits, but when we can go in and see in an electronic means that they're already scheduled for those wellness visits, that we build off of care plans when we're doing care coordination activities, that their PCPs and their instances of EMRs have already documented. And so that is very hard work. And again, we're not completely there yet. If anyone listening has figured it all out, please add me on LinkedIn and give me a call, because I'd be happy to hear from a CIN who has figured it all out from the provider-based space. But anyway, it's certainly a challenge, but I think that it has applications across what we do in quality or condition management or utilization management. And I think that all of the principles about clinician activation that we talked about last time and kind of building out those teams and points of contacts are critically important to translate those messages that we do. I call it, internally, we have one strategy with different flavors, right? We have a flavor that is applicable to our internal clinicians on their instance of their EMR, and we have a different flavor that is applicable to the clinicians who maybe are on dozens of different EMRs.
Yeah, that's great. It's I will accept your modesty, but also toot your horn a little bit, that while you guys may not have it figured out, you guys, as just evidence here in this conversation, are pretty good at it, and are probably more advanced than a lot of the other folks, and really impressed every time I talk with you guys about how you approach and work with your aligned providers. It's not an easy thing to do. We've been at this for a long time as well at Chess, and think you highlighted accurately some of those challenges. So I appreciate that, Wilson. I want to pivot a little bit, and we've talked a little bit about the importance of accurate, timely data, the reports, engagement. You guys are doing this at a large scale. I believe you said 108 value-based contracts. I know you guys have lots of different types of relationships with payers there in the Midwest, everything from probably quality and performance programs all the way up to capitated arrangements that you guys have. Speak about how Advocate, your approach maybe has changed, or your view on that about collaboration with payers within a large health system.
I think that I'm not going to go into the specifics maybe of, lots of payers, lots of relationships, or few payers. I think there's lots of debates I've heard from my colleagues in the industry of how you lean in. I feel very fortunate that we have some really wonderful payer partners, and I use that word specifically as they are partners. And I think partnership is key, and something that both health systems and payers maybe don't always lean into the value of those partnerships effectively. And it's certainly something I've learned over time, quite frankly. And I think about when I got here to Advocate 4 years ago, it was sort of building some work for some programs from scratch and bringing others together. And one of the things I spent a lot of time doing with our payers was listening to the questions they were asking and the suggestions they were making. And the reason I thought that was important is that understanding the reason they were asking a question helped me create so much of the strategy that we created 4 years ago and that we still live by. Josh, you've seen it today, that we've really worked in aligning. And doing that kind of listening session and understanding the core solves that they were trying to get at through strategies that they were recommending, or conversations we were having in our JOCs or breakout committees or things of that nature, helped me understand the breadth of gaps that are potential in value-based care, whether that's data or clinician activation or patient engagement or outreach or whatever. And so I think that would probably be the big thing I would focus on, is leveraging the strengths of the partnerships. And, not all payers have the same strengths. Not all clinician providers have the same strengths. And so I think leaning into those relationships, trying to reduce unnecessary overlap between programs that you're operating, having some co-accountability or delegation of the work that you're doing so that you have that division of responsibility of, hey, I'm going to do this and I need you to do that. And I think it's okay for either party to say, hey, I think you can do a better job with this than I can, whether that's, in-home assessments or, patient outreach or whatever. Trying to assess which partner has what strengths, I think, is really key. Being honest with yourself and building those trusting relationships to partner together.
I love that answer. I love the concept of leveraging the strengths of the payers. You're right. They're each have their own strengths and weaknesses. No one, I don't think, has it perfect. But I wanted to ask you all that question because obviously you guys have been very successful, not only in terms of the work that you do and how you set it up to create it, but actually in your performance of your contracts. And I like how you talked about that payer partnership. We think of it the same way here at Chess, because it really is important that you're working together to improve the lives of the patients that are in those contracts. It's not just a a sign it and be done. It really takes working together. So I really appreciate that.
And I think, Josh, to add on to that, I mean, you're right. I think we're here in population health to serve our patients ultimately, but also again our clinicians and care teams. And I went to my PCP yesterday for an annual visit, and when I go into the exam room, he isn't thinking about what payer I'm a part of, right? Or what, who my insurance payer or value-based agreement is, and if he's going to treat me differently because of that, right? So I think that's the other thing that we've tried to be very intentional of again, let's transform the whole operational model so that it's applicable to all patients and all payers. Sometimes, even if they're not in a value-based arrangement, how do we flex those muscles around quality care and again, aiming toward that top decile performance? Again, I think that helps us avoid any even kind of credibility issues with our clinicians, that we're really aiming about improving care for all.
That's right. Yep. Very well stated. Couldn't said it better myself. I think also an advertisement for those that are listening that more operations folks should be included in the development of value-based care going in the future, because it is about focusing the right thing and helping folks to and the clinicians in particular to drive that outcomes and improvement. That is what it is all about, and having people who know how to get that done is a challenge. But you guys are doing it very well. So, and to that point, Wilson, I wanted to ask, what advice would you provide to a clinician, practice, company, whatever the case may be, who's looking to advance in value-based care, and particularly as they move into and value-based care progresses into risk and even decapitation? What advice would you give them?
I think that if you're not in risk already, if you're not taking some pathway to getting there, you should. I know, again, I probably have a bias of this. I've been doing it for over 10 years now. I've been an advocate for taking risk and enabling it. Really, to me, I think it's so much about enabling this care model transition from back to what I talked about on the last episode of counting widgets to improving the health and well-being of the patients, again, we have privilege to serve. And I think obviously CMS has that onus, trying to drive their participants into value-based models, which is super exciting and has certainly changed over the last 15 years, and I'm glad to see it. But I would also say tactically, outside of this is something we should do, I'd say go find the partners who can help you do it. And this is, Josh didn't ask me to do this. This is not an advertisement for Chess. That might be Chess. That might be a payer partner who's really good at value, that you have knowing and trusting relationships with, that you feel like can maybe help you bridge into an upside shared savings or a shared risk or a pathway to risk. I do think that there's a lot of it, again, and I have a bias as a former practice operator and an operator at heart. It's also really core about laying the groundwork of operationally executing. And, if your physician compensation models, if you're a medical group operator, are really completely focused on fee-for-service and work RVUs, that's what you're going to get out of it, right? If your models are not focused, if your operators, if your physician leaders, your clinical leaders are not also accountable and motivated to also deliver high quality, that's something that immediately I think you can work to implement. So again, those are just a few things that I think of, that you're not at this alone. Listen and partner with your payers. Like I think I mentioned on the last question, they have a lot of really good ideas. They also have a lot of resources and expertise. So try to borrow shamelessly, share shamelessly from them to learn those best practices. And then again, start to begin to transform your your operations and develop the relationships with payers and value-based models that allow you to do so.
It's great advice, Wilson. Thank you for sharing that, and would encourage folks to listen to that advice. So one last question, Wilson. Again, really appreciate your time and all that you do for the movement to value, and for joining us on the podcast. But is there anything that I haven't asked you about that you feel would be really meaningful or informative to the conversation? Just want to give you the last word and let you add anything that maybe I haven't asked about.
I don't think anything super salient, Josh, but I think that I can't just help but be really excited for the future of value-based care, especially for that future here at Advocate and the work that we're doing together with partners like Chess. It's a super exciting time. It is never easy. So for those of you out there, I probably haven't said this enough through the podcast, this work is not easy. It's not for the faint of heart, but man, when we tie back to our connect to why, our connect to purpose, it sure is meaningful to me about the patients. Again, like people, like I grew up in rural Eastern Kentucky where health disparities were not hard to spot. And, people like my grandmother who had, less than ideal care and, quality care gaps that kind of fell through the cracks. And I think that I'd encourage us all to kind of keep that, remember our why, what our true north is of why we're doing all this work. And ultimately it's serving people like our loved ones and people in our communities.
Perfectly said. No need to say any more. Wilson Gabbard, thank you so much for joining us on the Move to Value podcast. Loved having you.
Thank you so much, Josh. Good to be here.
This is the Move to Value podcast, powered by Chess Health Solutions. We hope you have enjoyed this episode. If you would like more information about this and other episodes, you can head over to movetovaluepodcast.com to check out all of the available resources. If you're interested in continuing to hear about value-based care and how it impacts you, you can sign up for our email notifications or subscribe to this podcast on your favorite podcasting platform. Also, we would love it if you would share the Move to Value podcast across your networks and leave a rating or review. Thanks for listening.